Good afternoon, everybody, and thanks so much for joining us here again on KXAN Live. I'm Will DuPree coming to you from the KXAN Live studio on this cloudy Friday afternoon here in Austin. More details about the weather forecast and the changes that are in store, they're available on KXAN.com. But while we have you this afternoon, if you take a look at the banner down here at the bottom of the screen, we are talking about COVID-19 tracking. Once again, researchers from the University of Texas at Austin are looking into our wastewater to determine the levels of infections that are happening in our community. One of our digital reporters has been looking into this today and joins us now. Grace Reeder is here. Grace, very nice to see you. Thank you for being back here on KXAN Live.
Thanks for having me, Will.
We appreciate your reporting about COVID-19 as well, because we cannot let people forget that this is still making people sick. And sending them to the hospital as well. So let us know about, again, how this research is restarting in Austin, looking at COVID-19 levels.
Sure. So the UT folks had, they run out of funding this past fall, and so now they have been given a grant to be able to do a little bit more of this testing. And even though some of you may have some of those pandemic blues and you're ready to be done, unfortunately, the pandemic is not, as we know. And so what they're really trying to do, and why we could benefit from this now, is that when cases are so low here, it's a lot easier for them to detect big shifts that are coming. And so when we had big case counts, when researchers were looking at that wastewater, they could only tell 1 to 2 days out when there was going to be a major shift. But because there are so few cases right now, they can detect those shifts from as much as 2 weeks out. And so this is really new data that they're trying to provide folks. And the other reason, Will, that this is so important right now is that, as many of you know at home, because people are getting relaxed, they're not going and getting tested even when they have a sniffle, as we were perhaps this winter, and they're doing those at-home tests and not reporting them to the health authority. So when you go look at those numbers on the website that are simply those case counts, those might not be a great accurate depiction of what our community is facing right now, and this wastewater does a much better job of that.
It is so interesting that they can kind of use this additional piece of research and information to determine where we are as a community at the moment. I did want to remind everyone where we are right now in terms of the pandemic. So if you take a look right here, this is the latest dashboard that Austin Public Health has put up. There in the top left-hand corner, you can see that our community spread level is low. It has been for quite some time now, and there at the bottom in those very small numbers, you can see that 7 new people have been hospitalized recently, 36 currently in hospitals in the Travis County area battling COVID-19, while 2 are in intensive care and 1 person requires a ventilator. So again, this is still impacting people, Grace, and this research is coming back at a time, as you mentioned, that people may not be testing as much or testing at home, and those numbers may not be reflected in the numbers we're seeing out there.
Yeah, that's right. Obviously, these hospitalizations are thankfully so much lower than we were seeing when Omicron was in full force earlier this year and over the winter. But now they're saying that what this really helps with is, as those at-home tests become more popular, as we know, the Biden administration just allowed folks to order more of those at-home tests through the government. You can go get 8 of those online right now. So people may not be reporting those to the health authority as they may have been previously, and additionally, we're not seeing those big long lines for tests, and so people are not out getting tested as they were.
Interestingly, there is also an online tool available now where people right at home can track where wastewater samples are in the community. So tell us about this new tool and where people can access it and what it shows.
Sure. So this is a compilation of information from the CDC, from our local researchers, and from something called BioBot. And this came out earlier this year. This is the Travis County specific data, and as we were talking about earlier, you can see the gap in that data there. This is where they were not able to test the samples that they were taking at UT because they'd run out of funding. But you can see the data that they have collected from July of last year. You see that big Omicron surge, and then obviously, as we know, because of the case numbers, those plummeted down here into the April months. And so what we're seeing now on the right side of your screen there is really where we're at now, and we have seen a huge plummet since the Omicron surge technically ended, but as some of that immunity is waning from folks' vaccine doses, we're seeing a little bit of an uptick, and we've been seeing that since about the middle of March, as you can see on the right side of your screen there. Still not even close to what we were seeing at the height of the Omicron surge, thankfully.
And Grace, this is something that's going to be updated more frequently. From what I understand, live updates will be shared where the sampling is in our community.
Yeah, so this is going to be updated a lot more, and these trends follow national trends as well. So this isn't just a Travis County thing. You can find trends from anywhere in the county on this website, and it's really a big push by the CDC to make sure people have another tool in their arsenal to be able to figure out what's going on in their community with COVID-19. So yes, this will be updated. You'll be able to see it. They have updated it weekly, and in addition to that, Austin Public Health, who we used to be on here on KXAN live streaming their weekly news conferences, well, they are now sending a memo to city and county leaders every week to tell them what's going on with the pandemic, and this is one of the things that they talked about in that memo this week as well.
That is really so interesting. And you also found out where researchers are doing their samples here in Austin and Travis County. Where are those happening?
So there's 2 testing facilities that they are pulling all of that from. We've got those specific facilities if you're interested over at KXAN.com. We know too that they're going to be trying to do a lot more actually on the UT campus using some 3D models, and we are talking to them much more about that in the next coming weeks as they get those up and running to be able to determine on UT campus where exactly some of those cases are coming from, and hopefully they get to the point where that can be even dorm specific.
Wow. Get even to that granular level.
Specific dorms would be really cool, yeah.
Yeah, and if you all are just joining us, Grace Reeder, our digital reporter, is joining me to talk about how Austin is once again sampling wastewater here in our community to test where the COVID-19 infection levels are for us, since fewer people are getting tested at the moment. And you can also see in the middle of between us there this graph, which is available. You can click on the link on our website on KXAN.com to access this and look it over yourself and see where other communities have their sampling at the moment. It's very, very interesting there. We also got to hear from the CDC director about the importance of having this kind of sampling and testing available to health officials. Let's take a listen to why she explains this is so needed right now.
This is a powerful tool that, when paired with traditional public health surveillance, can help us identify where the disease is spreading and how best to distribute resources.
Grace, where are local health officials saying that this could help them when testing is lower? Those regular tests, those at-home tests, and maybe PCRs.
So this will allow them to not only be able to determine kind of where the higher pockets of COVID cases are as they sample from these different facilities, but they'll also be able to determine before case peaks happen when those are going to happen, and to be able to warn the community in advance before we start to see some of those hospitalizations, because that's where we really get into that mode when we see those high hospitalizations that people have to start wearing masks, social distancing again. None of us want to get back to that place, so this just gives them an early heads up to be able to say, hey, here's what's going on in our community before it gets to that point.
And we did show earlier where the situation stands in our community. We are at the low level. Grace, you had reported about the switch of kind of monitoring the COVID levels between low, medium, and high in our community. What does low exactly mean in terms of precautions for all of us out there?
Sure. So thankfully, this means that there are, as far as wearing masks and even for folks who are at high risk, this is the lowest level of risk. And so this means that masks are not recommended or required unless, of course, that makes you feel more comfortable or you've discussed it with your doctor and they recommend it for you. And and I'll just say too, that medium level and those high levels, even at that medium level, the CDC is not necessarily recommending that everyone wears masks, but at that high level, that's where it starts to be recommended for folks in schools and people in close quarters and such.
Thank you for that update, too. I knew that you would be able to explain a little bit more in depth about the different levels in case people out there wondered about what that is and kind of what corresponds with it. Grace, is there anything in your report that you really want to point out to people out there? Again, maybe mention why they are tracking this, why this is important to them to track even 3 years after the pandemic has officially arrived in the world.
Well, even after the pandemic ends, this is the type of testing that's still going to be really important. When we talked to these UT researchers, they said this is something where they can even test things like diabetes using wastewater testing. So this is not just COVID-19 that these resources can be utilized for. But when it does come to the pandemic, as we have talked to all of the local researchers and health authority, they remind us that even though we're in this lull right now, this point where cases are low, obviously new variants could come along, and this could be something that we're dealing with again in the future. And so this is just another tool to make sure that we've got a heads up when something like that might come around, and hopefully be able to curb that before we end up with those hospitalizations and ultimately deaths that we have seen previously.
Preparation is key. Grace Reeder, our digital reporter here at KXAN, thank you so much for your reporting. Very interesting story there, and you can check it out on our website, KXAN.com. We appreciate it, Grace.
Thank you.
All right, everybody. Thank you all again for joining us. As we just mentioned, Grace's in-depth reporting about why this is being done, why there was a delay in it, and getting it started again. You can find out all that again by clicking on our story on KXAN.com, so I'll direct you there. Thank you all again for watching. I'm Will DuPree in the KXAN Live Studio. We'll see you back here next week. Hope you all enjoy the weekend. Be safe out there. Take care.